Welcome to Health Today. I'm Christy Money, health educator at the Caldwell County Health Department. Today we're going to talk about family planning. According to the U.S. DHHS, North Carolina ranks 23 out of the 51 states on birth rates among women and girls ages 15 to 19, with one representing the highest. For every 1,000 females pregnant, there are 17 births for females aged 15 to 19 in North Carolina, making it the higher ranking than the U.S. average of 16.4. Also, according to NCDHHS, Caldwell County has a current high rate of more than 75 per 100,000 population rates of increased 28% from 22 to 23. We've talked about this before, of syphilis cases, making it important to be screened if you are pregnant. So today I have with me Stephany, who is one of our public health nurses, that is in charge of family planning. Stephany, I'm going to let you say your last name because I don't want to say it wrong. So tell everybody that.
Berrospe.
All right. Thank you, and thank you for being here with us today.
Yes, ma'am.
So, Stephany, tell me, what is the Title X Family Planning Clinic?
So Title X is just a program that is labeled under the Family Planning Clinic. But the Title X program is pretty much a national program for affordable birth control and reproductive health care that was established in 1970. And whether you believe it or not, there's many, people think, oh, family planning, it's just for females,
right,
and not males.
Yes.
But actually, it's for both. This program supports both males and females.
Which is great.
Which is really, if you're either able to get pregnant or if you're able to get someone pregnant, then you can be under the family planning program.
Which is awesome.
Yes.
That's great. So tell me, what is considered the reproductive age for those services for family planning?
So the age range they specify is 15 to 44 years of age. Not to say that, you can't get someone pregnant or you yourself get pregnant before then. So
Right.
That's just the age that they establish, but it really is really for anyone able to get pregnant or able to get someone else pregnant.
Right.
So, that doesn't include anyone who's had a hysterectomy or a bilateral tubal ligation.
Okay. All right. So if I have insurance, can I be seen? But is that the only, if I don't have insurance, can I be seen? So tell me about that part of the program.
So, there's many misconceptions that you can only be seen and get birth control if you do have insurance, which is not true. You can actually be seen in our clinic whether you have insurance or don't have insurance. If you do have insurance, then that's great. But if you don't have insurance, what we do is just ask you to provide a proof of income. And then based on that proof of income, there's a sliding fee scale depending how much of your total of your visit you owe, so 20%, 40%, just depending on what you tell us. We used to ask for physical evidence, like a paycheck stub or your W-2 forms, but now it can be done verbally.
Okay,
so
that's great.
yeah, so if somebody were to walk in and they're like, hey, I'd like to be seen for family planning, I'd like to get some birth control. Before, you used to have to set up an appointment, make you come back. But now, as long as there's availability, we can see you right on the spot.
Okay, so that was going to be my next question is, do they have to have an appointment? Do we take walk-ins? What does that look like with the clinic?
So typically we prefer appointments just to make sure, that there is plenty time for the patient to be seen. However, with last-minute cancellations or a provider being available, sometimes there can be exceptions to to
So they just need to call or come in and see kind of what the
really
situation
call
is.
and see what, how the day's flowing. Sometimes
Right.
a patient might have canceled in the morning or a couple patients might have canceled in the morning or for the afternoon, and we can squeeze someone in then.
Okay, that's
Yeah.
great.
But other than that, they already have insurance. If they're not insured, POI. There's also a thing called Family Planning Medicaid. Not many know about that, but it is a Medicaid specifically for family planning, which helps you with, getting an annual physical, and it gives you 6 visits throughout the year for like birth control refills or any other family-related problem you would have, like STD testing, pregnancy test, maybe you're having some issue with your periods, things like that. But in order to qualify for that family planning Medicaid, there's 4 requirements that need to be met. You either need to be a U.S. citizen or have lawful immigrant status in the U.S. You have to be a resident of the county of, well, actually North Carolina, but we prefer wherever you're applying, the county that you also live in. It does say that there has to be an income 195% or less of the federal poverty line, and you just have to be of reproductive age, which reproductive age, again, is 15 to 44 years of age.
Right.
Yeah.
So how do they find out about seeing if they're eligible for the Medicaid? Would they talk to someone in social services about that? I have seen that a couple times with patients whenever I used to work with patients that would have the family planning Medicaid, and that's a great thing. It really is. So that way, if you don't, need it for any other purpose, then the family planning part is great.
Part is great. Yeah,
Yes.
and I mean, like I said, it will cover your pap smear, birth control supplies. It's a really great thing. I know some patients come in and they're like, I just have family planning Medicaid, but it's actually a great insurance to have as well.
Yes, definitely.
And if anyone, I do try to talk to my patients about it when they come in. If I see that they don't have insurance, I'm like, have you tried to apply for family planning Medicaid, and try to send them on over to the social services department so that they can get that set up.
That's great.
Yeah.
That's definitely great. So can you tell me what services are offered in the family planning clinic?
Yeah, so of course, family planning, you automatically think birth control. So contraceptive services, we do pregnancy testing and counseling. We also do preconception health services to help achieve healthy pregnancies. If there's something we can't manage in our office, maybe somebody has PCOS or is struggling with infertility, we can definitely refer out to specialists in order for them to be seen. Pap smears, emergency contraception, Plan B, STD, STI, including HIV, Hep C, Hep B, syphilis testing, and certain treatment we can do in our office. And then for other hepatitis related and HIV, we do send refer our patients out to another clinic for that. But we do follow up with them as well. But testing, treatment, referrals, education on prevention of STDs, STIs, pregnancies, and overall counseling, a lot of counseling and education to our patients. We do offer free condoms at our front desk for anybody that would like some free condoms. And also with the family planning clinic, the male patients are the least seen patients in our offices. I mean, maybe in the time I've worked here, about 3 years now, I've maybe seen 1, 2 male patients. You mostly see female patients.
Right. So really the thing there is males be responsible and come in and get birth control. Don't just depend on the female to do it. We'd love to see you too, right? We see everybody, so come in and see us. We can take care of the males as well as the females.
Oh, for sure. Males are the least seen, but I mean, you can get condoms, you can get STD and STI testing, you can get counseling on it, maybe some education to help prevent pregnancy, especially teen pregnancy.
Right.
That's like one of the main goals is teen pregnancy. But we can also do referrals for, not only had mentioned before HIV, syphilis, but vasectomies.
Oh, yes.
Like
that's
there's,
right.
sometimes we get that female patient in like, I don't want to go on any birth control.
Right.
My husband might be interested in a vasectomy. Well, if their husband doesn't have insurance, they can apply for the family planning Medicaid and actually get that vasectomy through the family planning
That's
Medicaid.
great. That's
so
great.
I think it's a great option.
I think so too. That's awesome.
Yeah.
That we have that
Oh,
availability there. So I've been there forever, so I forget things too. So back to the condom thing, because I know that used to be a big thing that we would push. So they can come into the front desk and get condoms.
Mm-hmm.
So Stephany, if they come to the front desk and they want condoms, do they have to show like proof of ID? Do they have to show insurance?
No.
Or they can just get them?
Yeah, they can just get them.
Which is great.
Yeah,
that's a great
it's
thing
awesome.
to know. Yes.
I mean, not everybody knows that. Instead of going out and buying condoms, you can just walk in, go to the front desk and be like, hey, can I have some condoms? And they'll just hand them to you. No questions asked.
That's great.
Yeah.
That is really great to know.
I think it's really, it's neat that we do that.
Yes, I agree with that. And I can't remember with like, if a patient's on birth control pills, now we don't dispense those, right?
We do actually.
We do dispense them. Okay, so I can't remember if we still did that or not.
If our patients have insurance, we'll send a prescription to their pharmacy of choice.
Okay.
If they don't have insurance though, or they're like self-pay patients, don't have insurance, the birth control we offer are Nexplanons, IUDs. We also offer Depo, the pills, and then we also offer vaginal rings.
Okay. Mm-hmm. And of course, we have great providers there.
Oh, yeah.
We have Dr. Pigden. He is a former OBGYN.
He
He's
is.
awesome. And then, of course, we have Roger Keefer, and then we have Christy Ruff.
Yep.
They're all great, and they're all so easy to talk to and easy to work with, and they're awesome with patients, good with education, good with making you feel comfortable. Of course, our nurses are amazing too. So, we have a great service there at the health department to provide
I think
that.
so.
Yes.
All throughout, by the time you walk in, your vitals are taken, you go back to the nurse, we automatically start, asking like screening questions, what type of birth control have you been on? What type of birth control are you looking into? What do you think is your best option? Lay out these options for them. And then when they go back to see the provider, it's the same thing, like, going over each option and narrowing it down to seeing what works best for the patient. Even though we only do offer certain birth control in our clinic, if they're insured, or we have some patients that are willing to pay out of pocket for certain birth control, like the patches or diaphragms. Sometimes you do get that patient that comes in and it's like, I want to get my tubes tied, or I want to get a hysterectomy. Usually those we only do under insurance, unless they're willing to pay that amount. But I think we have a good range of services to offer in the family planning clinic. A good range of birth control to choose from, and different options with each also.
Yes.
It's not just one pill. If one pill doesn't work for you, we can definitely try a different pill, see if that works for you. We have quite a bit of different pills to go through to see what works for our patients.
Well, and that's the great thing too, is the education piece, where you can talk to the patients. I mean, they may say, oh, I definitely want this, but once you start talking to them and educate them on the different birth controls, they may have a different choice that they decide they want to do.
On.
I like that too.
And education, I think that's the most important thing that we do, is educate our patients so that they make the right decision based on their needs.
Right. Most definitely.
Yes, ma'am.
Well, thank you so much, Stephany, for
thank
being
you.
here.
Thank you for having me.
And if you have any questions or you want to schedule an appointment, call the health department. Our clinic hours are 8 to 5, Monday through Friday, and you can call 426-8400 to schedule an appointment.